Okay, class, it's time for today's test. Today we'll be taking the ACEs test. This is a group test. Raise your hand if any of these apply to you. 1. Your parents or guardian were separated or divorced. 2. You lived with a household member who was incarcerated. 3. You live with a household member who is mentally ill, depressed, or attempted suicide.
4. You saw or heard household members hurt or threaten to hurt each other.
5. A household member swore at, insulted, humiliated, or put you down in a way that scared you. Or a household member acted in a way that made you afraid you might be physically hurt.
6. Someone made you touch their private parts or touch your private parts in a way that was unwanted, against your will, or made you feel uncomfortable.
7. More than once you went without food, clothing, a place to live, or no one to protect you.
8. Someone pushed, grabbed, slapped, or threw something at you, or you were hit so hard that you were injured or had marks.
9. You lived with someone who had a problem with drinking or using drugs.
You often felt unsupported, unloved, and unprotected.
These are the basic questions of the ACEs test, which stands for Adverse Childhood Experiences. But there's more, like if
You have been in foster care.
You have lived with a parent or guardian who died.
You've been separated from your primary caregiver through deportation or immigration.
You have had a serious medical procedure or life-threatening illness.
You have often seen or heard violence.
you've been detained, arrested, or incarcerated.
You've often been treated badly because of race, religion, sexual orientation, place of birth, or disability.
You have experienced verbal or physical abuse or threats from a relationship.
The ACE study shows that as your score increases, so does your risk of suffering from mental health or medical problems.
Like chronic depression, cancer, or coronary heart disease.
And the study yields some surprising outcomes.
Like if you have a score of 4 or more on these themes, the likelihood of chronic pulmonary lung disease increases by 390%, hepatitis 240%, depression 460%, and attempted suicide 1,220%.
And these percentages are staggering.
Scary.
And can feel defeating.
But you know what's incredible?
These are things most of you have experienced.
And we're all here.
Together.
Working on making our life outcomes a little better.
So the idea that therapy is something to be ashamed about is statistically ridiculous.
Because we've all been through something.
Some of us have that body armor called resilience.
Some of us, these protections have broken down.
Some of us never had them in the first place.
But none of us are truly alone.
It's okay to ask for help.
You don't have to unpack it all by yourself.
And a percentage isn't a promise that this will happen to you. It's just a warning.
This is your sign to take action.
That's why you might be asked these questions.
Maybe by your doctor or therapist.
It's okay to talk.
And end the stigma so we can all
talk about it.
You're not the result of your environment.
And none of these things are your fault.
Talk to people who have been there too.
Talk to your school counselor, a trusted adult.
Let others be there for you. And be there for yourself.
The ACEs test, you don't need to study.
But you can prepare and learn from your score.
Be the example of ending the cycle.
Be the protection each other needs.
Let us be the last generation to take this test.
Once and for all.